What products should you be using pre-workout? There's so many products on the market, it's confusing, they're expensive, and they all have different things, different purposes, different goals. So which one do we go for? First off, most products are gonna contain what makes you feel the pre-workout. It's gonna have caffeine, niacin, beta-alanine, and maybe some other stimulant. So you're gonna feel the face tingles, you're gonna feel the jitters, you're gonna feel the energy. But does that necessarily mean it's the best product you can take? Usually not. So how do I build my pre-workout? First off, the base, I love citrulline. So this is pure L-citrulline. A lot of times you may see products with citrulline malate, and malic acid has its place. But for our purposes, we're using L-citrulline. Citrulline is gonna dilate the blood vessels, which basically means opening up the blood vessel, your veins, your arteries, and it's gonna bring in nutrients, oxygen. It's gonna give you a better pump in the gym. So regardless whether you're an athlete, whether you're training for strength, whether you're trying to get lean, whatever your goal is, we want blood flow. It's gonna make us more motivated to keep it in the gym when you get a great pump and you look great in the gym, and it's gonna help you recover when you're done training. So pure L-citrulline. If you'd like, you can also use some glycerol. Glycerol is also gonna pull more water into that muscle cell and further hydrate it. So 5-10 grams of glycerol, it's a great thing to add in there. Next up, tyrosine. So tyrosine is a non-stimulant focused product that I've become a big fan of. Tyrosine has been used in studies looking at ADHD patients who are trying not to use medications like Adderall, trying to use a natural form. And in those studies, we found around 15 grams is a spot where anything more than that basically just becomes waste. You urinate it out and now you get expensive urine. So upwards of about 10 grams, 8 to 12 grams is where I'd like. You'll find in a lot of focus products, nootropics, they'll use tyrosine, but maybe in half a gram, maybe 2 grams. So give yourself a try with 10 grams of tyrosine. You'll see insane mental focus and a mind-muscle connection. All right, next up, we're gonna talk about caffeine. So caffeine is a great stimulant. It's been around, it's been tested. We know how it works, but too much caffeine is a bad thing. So how much do we want? I recommend anywhere from 50 milligrams upwards of about 200 milligrams max pre-workout. Caffeine and any other stimulant is gonna be a vasoconstrictor, which means it's gonna basically close those blood vessels. And like I said, with citrulline, we're trying to dilate the blood vessel. We're trying to get as much oxygen, nutrients, blood in there as possible. Okay, so why are we gonna take something that's gonna counteract that? So what's the sweet spot? 50 to 200. That's enough to give you energy, increase your metabolism, increase performance, increase mental focus, but it's not gonna be a detriment to the blood flow. Okay. Next, creatine. Creatine has been around since the 60s. It's been studied. We know the side effects that are minimal. We know it's effective. We know how much to use. So I recommend creatine monohydrate. It's been tested. It works. It's absorbed 100%. Anywhere from about 3 to 5 grams is where we want it. Start low. Take that lower dose for a few days, maybe a week, and then go upwards from there. So maybe 2, do that for a little bit, go to 3, 4, 5, etc. And that's where you want your creatine sitting at. Too much right off the bat may upset your stomach a little bit. Creatine is basically gonna pull water into the muscle as well. And it's also gonna be almost like an energy reserve, okay? For those bigger, heavier lifts that are using that energy source. Okay, so what that means is it's not gonna increase your lifts right off the bat. You're not gonna gain 20 pounds on your squat or your bench. You may get an extra rep or 2 each workout, which over time is gonna lead to better gains. It's also great for your brain health. It's been studied for Alzheimer's and dementia patients with great effects. So creatine's another one to add. If you're an endurance athlete, I would recommend something like beta-alanine, which over time, those tingles, that paresthesia, the face tingles, that'll stop and it'll increase your oxygen uptake over time. So about 3 to 5 grams for about 3 months, and you really start to get the benefits of it. So which products should you take? There's a few I like. I like a product called Volugen by Morphogen Nutrition. I also like Gorilla Mode Nitrix by Gorilla Mode. They have a lot of these products that I'm talking about, and if they don't have something, I just add it in. Those are both non-stimulants. I like using a non-stimulant because then you can add your caffeine source as necessary. You can always buy these products just online in bulk. If you're on a budget, buy your creatine, buy your caffeine pills, or use your coffee, your tyrosine, and your citrulline, and just mix the powders together. Maybe sweeten it with a little bit of a juice that you like, or an electrolyte product would be even better. And there you go. It's cheap, it's effective, it works. Stay tuned for more information.